All right, thank you. So I guess if you're not quite awake, this might wake you up. But I will definitely be as efficient as I can. I know you guys have all been here all day, so much appreciated for sticking around for this last segment. So just to briefly introduce myself, my name is Jessica Mandac. I'm a full-time physical therapist working at the Rehabilitation Institute of Chicago. Some of you may not have heard of it. It's actually just right east of here on Superior. That's our main hospital. I work there occasionally, but my primary location is at our Center for Pain Management, which is on the corner of Michigan and Oak Street. So just going to talk today about some of the benefits and positive points of how physical therapy can really be effective when you have this diagnosis of scleroderma. So I'll initially just kind of chat about what us as physical therapists know about this diagnosis. Then I'll get into some of the outcomes that we're looking at. I'll also talk about some of the muscular or the body systems that are involved, how we can treat that as physical therapists, and what you guys would do to help yourselves with that. Briefly talk about an interdisciplinary approach, and then I'll end with talking about a patient case and a recent patient that I have recently treated just this past summer. So it's kind of the breakdown of just the rest of the afternoon for you. So just kind of basic, what us as physical therapists know, and you guys all know this, and you've heard more in-depth presentations about each of this throughout your day today. So autoimmune disorder is a rheumatic disease, it's fibrotic, and it's chronic, and it can be progressive. Those two go pretty much hand in hand. And then the two different types of scleroderma or systemic sclerosis that you could have. So, common symptoms that we'll hear patients or individuals with scleroderma tell us, there's not just the physical aspects, which you think as physical therapy and as a PT, that's all we would hear, but that's not quite the case. There's definitely other symptoms that come along with it. Now, in terms of physical therapy, I am going to hear a lot about the fatigue that someone's going to have, feeling tired, pain. I hear a lot about pain working at a center that is all about chronic pain. So that's something I'm focused on daily. Joint stiffness, if anyone has any difficulty with that, difficulty opening the mouth, having ulcers, weakness is another big one. And then just the emotional and psychological factors that come along with it that can also impact treatment sessions. So I'm not specifically working on those, but they can definitely impact a treatment session. So it's just nice to be aware that they're there. So the first body system that I want to talk about is the musculoskeletal system. Primarily because this is the biggest one that I will treat and work with as a physical therapist. So just some kind of basic symptoms that we'll have. Myositis is muscle breakdown. Soft tissue restrictions, so that meaning muscles can become tight. Okay, our joints aren't moving as well. There's specific joints that tend to get more restricted than others. Mostly we'll see a lot in shoulders, a lot in hips, knees, even ankles. And I will have a fair amount of patients that'll say that they have a lot of neck or back pain, and that can also be related to lack of movement in your spine. Okay, contractures can happen as well, and that's just an abnormal tightening of muscle. If there's a significant contracture that you have, oftentimes you're going to need some sort of splinting to really help with that and help over time. Because just kind of a standard stretch that you might think of for that area won't be as effective. Pulmonary and cardiac system. So again, kind of throughout the day, you've heard just about these different systems. Different things that we'll hear and see: pulmonary hypertension, vasculitis, so inflammation in vascular tissue, blood vessels, and things like that. Dyspnea, which is just a fancy word for shortness of breath. Some of you might experience that. That can definitely affect a treatment session. anemia, chest wall restrictions, and this we do see a lot and can treat it because as you think about your chest wall, that's what's surrounding your lungs. Okay, so your chest wall, meaning your ribs, your intercostal muscles that are going to help with your lung movement, if those are restricted and the joints of your rib cage aren't moving as well, or not moving well along your spine, that can definitely affect how you're breathing as well. Interstitial lung disease is something you've just recently heard about, and then just poor circulation. Some of these other systems that aren't necessarily treated as primarily, but can definitely still come up. You all may experience different ones of these. Integumentary or skin, that's a really common one. Skin thickening and just feeling really tight. Lymphatic system, so you may get a good amount of swelling. This can be related to your lymph nodes. Those can also become restricted and become thickened, so our lymph fluid is not moving as well. Swelling on that kind of second note can affect joint movement and affect how you're moving, which is then what we're going to focus on in physical therapy. The GI system, we don't do specific things with your GI system, but we'll hear a lot about constipation or stomach pain, and we'll get into how to treat these and kind of what can help with that. And then the nervous system. So actually, this is something we do treat quite often. For some reason, whether it's because of the narrowing or the restrictions that you get in your joints and things like that, there are some peripheral nerves, or nerves that innervate our hands and our arms, that can become entrapped. So the median nerve is one common one. If you've ever heard of carpal tunnel syndrome or been affected with carpal tunnel syndrome, the median nerve is that nerve. It runs right through into your hand. The ulnar nerve is another one, which again runs right into your hand and your forearm. Those two nerves are the most common ones in your hand. And that isn't what's going to cause like feeling of that coldness or maybe numbness. But if you have any of these symptoms, it would be more burning, tingly type of feelings if you have anything that's associated with these nerves in your hands. And then the trigeminal nerve is actually a nerve that innervates muscles in your face. So, as I said earlier, some people complain about opening their mouth or with eating. The trigeminal nerve runs right through your face and innervates cheek muscles. So if that's affected, you can kind of, again, get that burning kind of tingly feeling in your face as well, and that can be treated. So these are, I'm going to kind of go through these a little bit more quickly. These are just called outcome measure tools. The forms on the left there, the names of them. On the right is what they're looking at. So we have to know what are your daily activities? How are they affected? Are your recreational activities affected? Are you still working? Are your work activities becoming affected? Are you having trouble with sleep, fatigue, depression, anxiety, and mood? Just in general, your overall health. And like I said earlier, what I experience a lot with my patients is pain and fear. So not all of these are going to be on slides, but briefly you'll just kind of see these different outcome measure tools. Just in case if you have or will be in therapy, it's nice to kind of know. Which, just quickly, show of hands, how many have had physical therapy? Whether it's not for scleroderma reasons, just awesome. Okay. So got a good background here already, which is great. So this is the health assessment questionnaire. That one is pretty efficient, kind of covers a lot of different things. The Tampa scale I use daily, and this one it looks at fear of movement. So phobia is just a fear of something, kinese means movement. So when we are giving patients this outcome measure tool, we're looking, is there some sort of fear associated with what we may do in physical therapy with some sort of physical movement because of pain or because of joint stiffness and things like that. And the next one here, the lower extremity functional scale. Again, I use this on a daily basis, and it's just a really nice tool to look at a lot of functional activities you might do and break it down based on difficulty level. We'll see a little bit more about scoring and how these are actually useful in a therapy session, A little bit later, we talk about that patient case, so just kind of remember that we have that. And then this is a really common one, again, used on a daily basis, and if you guys are experiencing pain and have had physical therapy, or you go to the doctor and they ask you, what's your pain level today? 0 to 10. This is the visual analog scale. Some people like to see it in that visual form. Others are pretty familiar and can understand their own pain level. There's a lot of different scales to look at it too with pain, but we, as working with patients with chronic pain, I always have to know kind of where are we at with baselines with pain, because that's going to affect therapy. So let's start to get in and just how to treat some of these systems that we talked about. So initially, we'll talk about the musculoskeletal system, because like I said, from a physical therapy standpoint, this is the one that we are primarily treating. So oftentimes, when we have these different symptoms of scleroderma, we're getting weakness and we're getting instability in certain joints and certain muscles. Common, our core and our trunk, which keep us up nice and tall. Our upper back and our shoulder muscles can become really weak. Our hips and our glute muscles and our ankles. So oftentimes the weakness is coming from the fact that we're not able to move as much as we used to, right? Maybe we can't do as many physical activities as we used to do. We can't do the type of physical activity that we used to do. So if we're not moving as much, we're not being able to utilize this muscle tissue, it's not going to strengthen. Unfortunately, muscle tissue breaks down a lot faster than it does to build up. So these are the specific areas that mostly we're going to be working on when it comes to physical therapy. Often too, when we have weakness or when we have pain and we have joint stiffness, we tend to take on a certain posture. And this is affected in terms of how it keeps us strong and how it keeps us mobile. The posture tends to be, and this can even just be from sitting for a long time, but the posture, we tend to become a little bit more rounded. Okay, our shoulders come forward, our chest can become tight, which can then make our upper back muscles lengthen and not in a great position to really keep us strong and stable. Then our pelvis comes back, so our hips get tight. Core gets weak and our low back gets weak. It's kind of like a crossed posture. And it's honestly, we're working on the whole body. Even if you maybe only feel stiffness or pain in a certain area, it's definitely affecting your whole system, because as you think about it, we're a big chain. Okay, our body's all connected, and if one area isn't very strong, it's going to affect other areas of your body. And then below that is mobility. So you all know, I'm sure, and maybe more so than others, the lack of movement that can happen, just feeling tight, feeling stiff. Okay, so different ways that we can work on that, doing some gentle movement, doing active and active-assisted range of motion exercises. And active-assisted meaning you're definitely still doing it, you're being active in that, and you're doing the activity, but something is helping you to gain a little bit more motion. And then general stretching, which is what you would think of when you maybe have just done stretching in general, holding a stretch for a certain amount of time, feeling that muscle just kind of lengthen. And then on the left there, so on the right, a bit more active approaches, right? You're going to do that on your own. You'll get taught and you'll get guided through what's going to be best for you, and then you can use that at home or use that at work or whatever it may be. On the left would be more passive approaches that maybe a physical therapist would do for you to help if there's really significant restrictions there. So joint mobilization in a specific joint that maybe is necessary for you, whether it's your shoulders, hips, knees, things like that. Passive range of motion, so just passive stretching of a joint. Soft tissue massage, and then occasionally you may see some modalities, ultrasound, heating pad, I didn't put it up there, but paraffin sometimes if you have hand stiffness and tightness. You can see that too. So the next couple slides that I put on here, they're just groupings of certain exercises. They're probably pretty small on the handouts that you have, but I grouped together nice pictures of areas that we would focus on in terms of either strengthening or working on joint mobility. So the first three I should say, are about stability. So we talked about the areas that can become weak. So our core, our upper back muscles, our glute muscles. And these exercises just show the different ways that we can focus on those different areas of our muscles, okay, different groups. I think we have time for this. So real quick, just again to kind of wake you guys up, let's just see if you can all find your lower abdominal muscles, okay? That's one of the most important muscles when it comes to working on core stability. So what you're going to do, I'm going to come up here. Can you all hear me fine? Okay. So you have two bones in the front of your hips, okay? You can feel that? Nice and bony. For you guys, they're all pointing towards the screen here. Okay, so with one or two fingers, just kind of slide off of those bones. You kind of are on like skin now, right? So either cough or clear your throat for me. Okay, did you guys feel something kind of get tight under your fingers? Yeah. So now that's where our lower abdominal muscles are at. One of the primary muscles that we're looking at, and is a baseline and kind of a support for all of these muscles, these exercises that we do here. Now, every time we do it, we're not going to have you cough and clear your throat. Eventually, you just want to gradually bring your belly button back and just kind of feel that area get kind of tight, kind of like a little belt around your waist. So, again, it's just kind of a baseline, but it's a nice baseline when you think about, then we're going to progress with all these other exercises. Now, these are in various positions. So, on your back, on your side, possibly even on hands and knees. We always like to incorporate some functional positions too. Functional meaning standing, moving, walking, okay? Because we know, and the primary goal is to increase function, right? So we know and we hope that you're not having to lay down all day. Okay, so we want to incorporate how can you use these muscles in a functional way to make these functional activities, getting up and down from a chair, getting in and out of the car, walking. How can we make that easier? This slide is the same exercises, but if someone can't tolerate it, maybe lying on their back or lying on their sides or their stomach, these are all done in a chair or in standing. So just a nice modification in case some people aren't comfortable with some of the other positions. Okay, and along with strengthening and working on core and gluteals, like I said earlier, that posture that we kind of take on, our upper back can become pretty weak, our chest can become pretty tight. So these exercises are focused on strengthening your upper back, offering stability to your shoulders, which can become stiff and painful. Offering stability to your neck, which may not move as well. So these exercises kind of break that down. And then that last one there on the bottom right for you is actually a stretch for your chest. So again, to complement the stability that we're giving you, stretching out the front of your chest, which can become very tight. Not as many and not as common, but lack of ankle stability, and maybe this is because of joint restrictions in your ankles. Your ankles aren't moving as well. Maybe you have swelling in your lower legs or in your ankle area in your feet. This can affect how you're walking. Okay, this can affect a lot of things that you do in standing. So if there's weakness there, we really want to make sure that we're working on that. So this is just several different exercises to focus on improving ankle stability. Again, like I said, we're all a big chain. So if we're working our hips and we're working our core, simultaneously we're going to be working and strengthening our lower legs and our ankles. Alright, so to continue, this is getting into stretching. So mobilizing soft tissue, meaning muscles, mobilizing joints. And all these, again, kind of like I did with the core, they're all grouped. So I just grouped these exercises, focused on the primary areas that a lot of patients are going to feel those restrictions and feel pretty tight. Again, these kind of start in various positions and they progress to a sitting position. The common areas that they're really going to focus on are going to be the front of your hips. They're going to be your trunk. Oftentimes spine and trunk isn't moving as well. Neck stretches, and even front of our chest, like I said before. And then again, just like with the core, these are all in sitting. So if someone can't tolerate some of the lying down positions for stretching, these are how to do them in sitting. There's always modifications for everything, and I say that on a daily basis to my patients because I'll get often, I can't do that in that position, I don't think that's going to work for me. There's ways to modify everything. So if you were told a modification, you should have been, or there will be some way to make that more tolerable for you so that you're getting something out of it, getting a benefit out of it. And then briefly, we'll just talk about the oral and facial exercises. Like I said, some people will complain of it's hard to open their mouth, it's hard to chew, it's hard to eat. And just as with your other joints, your shoulder joints, your knees, your ankles, your hips, your jaw is a joint as well. And that can become tight, it can become restricted. There can be even swelling there. So if that's the case, it's definitely going to affect how you open your mouth. And even with talking, even with eating, which are things that we're doing on a daily basis, so it'd be nice if it was a little bit less challenging. So these are just some active exercises that you can do to work on mouth movement, work on opening and closing. There's even some stretches using your hands to really loosen up the muscles of your cheeks, which could become and feel restricted as well. So these next two, they are terribly, in terms of artistic, so if anyone's an artist in here, I apologize. I'm not. But these next two slides are about chair yoga. So actually in the center where I work, we have group classes, and chair yoga is one of them. Yoga in general is just, if any of you have done yoga or do yoga, it's a great way to work on mobility. Great way to work on loosening up soft tissue structures, loosening up your joints. And we just modify this to give you different movements and sequences in a chair. And if you can tolerate standing yoga, that's great. You keep doing that. It's just nice to then have seated versions in case you're out and about and you need a little bit of movement if you're traveling, if you're at work sitting for a while, on the bus, in the car, whatever it might be. It's nice to have some seated options as well. So these next two slides, this one, and then this one, just additional yoga, chair yoga exercises, again, to work on really improving that joint mobility, that soft tissue movement, which then will give you a better option and a better opportunity to work on the stability of these muscle areas. Alright, so that was a good chunk about the musculoskeletal system. Now let's kind of chat about pulmonary and cardiovascular. This is actually another common area that we're going to treat in terms of in a physical therapy session or at physical therapy. So, common pieces of equipment that patients that I have and individuals already are used to: treadmills, cycling, arm bikes, the elliptical, the new step. Doesn't really matter which piece of equipment you're using. This second chunk here is going to tell you why and how you're getting benefits out of that. So we found that if you're in a 60 to 80% target heart rate range, which soon here we'll figure out how to find that, and you're going to use your maximum heart rate, if you're within that range, you're having a lot of benefits. Okay, so you're working on strengthening your heart tissue. You're working on improving blood flow, which you've heard and seen in some of these other presentations can become less because of the narrowing of some of your arteries, things in your lungs. This is going to improve that. It's going to help with oxygenation to tissues as well, having them work a little bit better. And then also, it's giving you endorphin release. So I'm sure everyone is familiar with endorphins, but if you've done working out or you've heard of people that have gone on runs or after they've done a workout and they say it feels good, that's why. The natural release of endorphins just makes you feel good. and it's a natural pain reliever. So it's a nice thing to be able to tell my patients that have pain on a daily basis, here's a free way to get some pain relief rather than medication and things like that. So it's nice to be able to figure out how to make that work for them. So this doesn't have to be done now by any means, but this was a nice just breakdown of how to find that target heart rate zone for yourself, because it's going to be based on your age. The common one that's been used, and you may have heard of it, is 220 minus your age. That's kind of an older one, but it's convenient. This one's a little bit more specific for your age, and it finds that 60 to 80%. So if you have this, and as you're working on your cardiovascular exercise, you can see, how am I doing? Am I getting in this zone? Okay? And if you're not, but you're not feeling like there's much change with symptoms, you then can kind of see how you can push yourself. Okay? And also know that with heart rate and with intensity, when you start, you definitely want to start at a lower intensity if it's not something that you've been doing consistently. Okay, but this heart rate zone can be really helpful to know how can you increase your intensity. Because as you're starting off, and if you start at that lower level, and you're noticing as you do this for a period of time, 10, 15, 20, up to 30 minutes, and your heart rate's not changing much, and you're feeling like, this is becoming a little bit less challenging, well, then you can bump up your intensity a little bit. And that means different things based on the equipment that you're using. But it's a nice way to know how can I challenge myself cardiovascularly appropriately. Okay? This next slide here is just what we use and what I use to track my cardiovascular and conditioning efforts with the patients that I see. So just tracking intensity and how is that relating to their heart rate and their pain. Pain is going to be a really big one that we're watching. And how are you seeing your intensity level change with your heart rate, and is pain being affected at all? So it's just kind of a nice sheet to have to track that. All right, and then these last couple of systems here, we'll do starting on that right side first, so the integumentary and lymphatic system. Again, the skin in physical therapy, not working on that a whole lot in session, doing some soft tissue massage, doing some gentle range of motion could really just help feel less restricted in your skin. The lymphatic system, if you are noticing and there's a lot of lymph buildup or there's a lot of edema, you may actually need a manual lymph massage. So there's certain therapists, and it doesn't just have to be physical therapy actually. Occupational therapists are certified in this. Some nurses are certified in this, and it's just called MANA certified. So if you ever see a therapist with that behind their name, they're certified in manual lymphedema drainage. So you might need that and have some benefit with that. The GI system, I told you we'd get back to this. So largely how we would affect that in physical therapy is that cardiovascular activity we just talked about. Cardiovascular, I know I said it's improving heart tissue or endorphin releasing. It's also working on intestinal motility. So your GI system is just going to like you and work a little bit better if you're moving and if you're getting that regular cardiovascular activity. And then the nervous system, so we do treat this a little bit more like I had said, with some of these nerves, these peripheral nerves in our arms and our hands that can just become restricted. So you may not think of nerves as becoming tight or feeling stiff like your muscles because you don't feel nerves the same way, right? They just help us move and we kind of know that. Well, nerves are encased in a sheath, and that sheath can become restricted just like joint tissue, just like cartilage and your muscle. If that sheath is tight, that nerve is not going to run through very smoothly. So if you think about like a straw and a noodle in that straw, okay? If that straw is open nice and wide, that noodle can run in and out just fine. If there's any sort of kink in it or if it's narrow, that noodle's not going to move very well. Same way with our nerves. And we can work on mobilizing that a little bit better. So these next slides here will show you that. So that median nerve that runs right through here, that's what's giving you your sensation here on your forearm, into your thumb, and your first couple of fingers. Okay, it's also giving you motor for your wrist. And then the ulnar nerve runs on the other side, giving you sensation here to your last two fingers, and again, just a little bit more motor for your wrist. So, like I said, if you're feeling in these areas, you may get some tingling, some burning, and you've been diagnosed or seen the doctor, and they said maybe you have these nerve entrapments. These are the nerves that most likely can be affected. Oftentimes it'll just be on one side versus the other. Sometimes you can have both feeling this way, it just kind of depends. And the last one here is that trigeminal nerve. So remember that nerve that runs right through your jaw here, right into your face, innervates tissues and muscle structures within your face to help you move your jaw. Again, it can become restricted. So this is just kind of a breakdown on how to find and feel that trigeminal nerve. When you're working on mobilizing nerve tissue, it does feel different. So it doesn't feel like you're stretching a muscle. It can actually feel a little bit more annoying than that. And nerves are sensitive, so if you're stretching and you're mobilizing your nerve tissue, you just have to be aware of that and understand that you don't want to stretch them as far or as long and as consistently, because they're just a little bit more sensitive than muscle tissue. All right, anyone do aquatic therapy or have done pool therapy? Okay, so this can be really beneficial in the sense that when you're in water, the hydrostatic pressure of the water on your body is actually helping to circulate fluid in your body, so it can get rid of some of that swelling. It can also release some of the pressure and the heaviness that you feel on your joints. So when you're in this water, you could definitely feel lighter. So with that, we can work on decreasing some of the stiffness. Work on strengthening in the water, because we don't have gravity, we don't have that pressure holding us down. Okay, hopefully decrease some pain and then just overall improve function. Now we have to remember too that we don't live in the water, so it may feel great at the time, but we still have to get out. So have to really pace yourself when you're in water, because when you get out, almost immediately sometimes you can feel that effect of that gravity just come back on you. So you have to be careful with that. Ideally, water should be about 98.6 degrees if it's therapeutic, okay? Depending on the level, the higher the water is on you, the more pressure relief you're going to have, okay? And the more fluid that you're going to have going through your body. You can use water dumbbells, kickboards, pool noodles, ankle weights, whether it's to assist with movement or help with resistance and strengthening. Okay, and again, these next two exercises, or handouts on the slide, are just aquatic exercises that I've given my patients. So it incorporates cardio, it incorporates strengthening and mobility. We utilize the noodles, we utilize the kickboards and the dumbbells, we utilize it all to really work on that strengthening and that mobility aspect. This slide here, I really wanted to incorporate because often, especially in a setting of chronic pain or setting of a place where I'm going to see patients with chronic illnesses like Scleroderma, patients will ask me, how am I supposed to move more than I already am? How am I supposed to do that cardiovascular activity when I'm already feeling pretty stiff, when I already have a good amount of pain? When I can't breathe that well, how am I supposed to do these things? Looking at this pyramid is a really nice way to judge your activity level. Okay, so you're starting in that green light, going up to yellow isn't bad. Oftentimes we think that when we get into yellow, which could be pains going up a little bit, and starting to feel more stiff, I can't breathe as well, that is a bad thing, and then we kind of may have some fear associated with that, or we immediately want to stop doing an activity. Not the case, if we're in that yellow zone, it's okay. It's just how then can we come back down to that green zone. So really just monitoring your activity level that way and using this pyramid can be really helpful. Okay, and then right before we talk about that patient case, you've seen, and I know it was quick, but the benefits that physical therapy in itself can have when we're dealing with some of these symptoms of this disease. Research also shows that a multidisciplinary or an interdisciplinary approach is going to be very beneficial. So having physicians and nursing there, having physical therapists, occupational therapists, psychologists, biofeedback therapists, and vocational therapists all in one setting can really be very helpful and help with what we're going to work on in physical therapy. Because as you all know, this isn't just a disease that affects physical things, okay? There's a lot that comes along with it. So it's nice to have that all-encompassing approach when going through something like this. All right, and then last here is the clinical example or the patient case. So I won't read all that. You guys can read that. But this was a patient that I had treated this past summer. And in our clinic, it's a little different. We have certain programs. So she was in one of these programs, which meant that she came for 6 weeks, and only 6 weeks. She came once a week, and I saw her for an hour for physical therapy. She also then had an hour of occupational therapy, psychology. She was going to a relaxation group, and then seeing the physician and nurses. So she got all of these in one day. So, you see her age up there. Some of the symptoms that she reported to myself and to the doctor are some of the same symptoms that I talked about in some of those earlier slides. So she was having trouble swallowing. She was having severe constipation, feeling bloated, having a lack of circulation to her fingers, which causes ulcers, having a large amount of joint pain. She was getting some swelling. She didn't feel like her shoulders were moving like they used to. Starting to become irritable and having panic attacks. So, we kind of read through her subjective, hopefully, by now, but that last one of the things she told me, it just really stuck with me, is she felt like a 98-year-old in a 48-year-old body. So she was the young patient that I've seen. She just felt like she had aged so much by the time I had seen her. So she described her pain to me, and if any of you feel the same way, it was constant, it was achy, it was sharp, it could be shooting, she felt tight, and then she also felt some itchiness which caused her pain, and that could just be that skin breakdown. So she had told me what makes her pain worse. Morning time often felt much worse to her. Weather definitely affected her pain, stress level, and when she tried to do more activity. So using the activity pyramid came really handy for her, because often she was like, how do I do this when I already tried to do more activity and it hurts? The only thing she had at that time that really felt better was wrist braces and getting in warm baths. So it was one that was really helping her kind of manage this pain that she was feeling. So we had looked at with her those outcome measure tools that I mentioned before, the lower extremity functional scale and the Tampa scale. So lower extremity functional scale looking at her perception of how much she could function. And it's out of 100. So she scored 21%. So which is very low in terms of what she thought she could do. The Tampa scale then looking at fear of movement. So that's what that scale was looking at again. And with that one, anything 37 or higher indicates that there's some sort of fear of movement associated with what we're going to do in terms of activity, whether that's because of pain or because of joint stiffness and things like that. So she was definitely high in the score on that one. So when I looked at her and I did her initial assessment of physical therapy, biggest deficits that I found, she had a lot of loss of neck movement and low back movement. She had a lot of weakness in her hips and her gluteals. Her core was very weak as well. Significant lack of hip and knee mobility. She was very restricted and tight in her hips and her knees. And she had some pretty poor endurance. So with that then, how we treated that, the cardiovascular activity, absolutely. So we found that target heart rate zone for her. She preferred to do a lot of activity on the treadmill, so that's what we did. Like I said, there's so many other ways you can get cardio, but that's what she wanted to do. And then just working on her trunk movement, her spine movement, chest, hips, legs. A lot of the exercises that I put on those last couple slides, she had in her home exercise program. So she had all of that. And then again, gluteal, hip, and then core strengthening. So she had a good chunk and a good home exercise program to do consistently on her own. And I say the word consistently because that would be key. She was okay with doing it. She was not as consistent as she could be, but she did okay. And that'll definitely affect what her outcomes are and what you feel like. So by discharge, we didn't see a lot of difference in her neck or low back mobility. A little bit of flexibility improvement. And where she gained the most was in her core and gluteal strength, which was great because just functionally, that was helping her do a little bit more. So when we look at those outcome measure tools again, she went from a 21 initially to a 41, so her perception of her function was improving, which is awesome. And then her TAMPA scale, which was at that fear of movement, it went down. So she was having less associated fear with movement. She was looking and seeing physical activity and physical movement differently, which is great. All right. Very quick and efficient, I hope, but does anyone have any questions about physical therapy? Anything? Yes?